for me, one of the best pieces of advice that anyone ever gave me when considering a preventative mastectomy was to think about where you might be in 5 years and where you might be in 10 years and what's going to be happening in your life at that point, and how you would feel about your decision if you decided to go with the surgery, and then how you would feel if you decided not to go with the surgery. And the same thing applies to if you were to get a cancer diagnosis and you chose to do the surgery or chose not to do the surgery, how at that point would that affect your feelings about your decision?
So good day, everyone. Welcome to the Voice of Cancer Patient Talks, a platform to empower the cancer community. Our guest speaker today is Krista Brown. Krista is an Integrative Cancer Prevention Coach and is currently finishing her master's degree in medical nutrition. Am I right?
Yes, that's correct.
Yeah. So thank you so much for your time, Krista. Thanks a lot.
Yes, thanks for having me.
Shall we dive in?
Yeah, let's do it.
Can you tell us a bit more about your personal experience with cancer and the motivation behind becoming a cancer coach?
Sure. So my experience really started with my mother's cancer diagnosis. She was diagnosed with breast cancer, and watching her 12-year journey is kind of where I got started. She was very young and healthy, and cancer wasn't something that any of us really expected at that time. And I was in nursing school at the time, and watching her really shaped my perception of the patient experience and what they go through. And she did a lot of research and read a lot and was an out-of-the-box thinker. And so I was taught things from her that I wasn't privileged to learn in a traditional medical model. And I always admired that about her. So not long after her diagnosis, she was tested for the BRCA gene, which at that time was really the only genetic mutation that was linked to breast cancer. And she was negative. And I remember her relief because she has 5 daughters and was worried about passing that along to us. So fast forward 12 years, a few months before she passed away, she was retested. One of her providers suggested being retested for some of the newer genes that they had found. So she did the testing and found out she was positive for what's called an ATM mutation. And it was a pathogenic variant. So it was most likely a contributor to her cancer diagnosis and the development of her disease. So she passed away a few months later, and it wasn't until 3 or 4 months went by that I decided to consider doing genetic testing for myself. So I was a little hesitant, to be honest. I was hesitant at first because I didn't really understand the purpose, like what was it going to help, right? It would just be an added stressor in my life, is what my feelings were at that time. But the more I researched and started to learn, was that a positive result in genetic testing means that you have access to earlier screenings, and earlier screenings meant earlier detection and earlier treatment. And we know that the earlier cancer is detected, the better your outcome is going to be and the more treatment options that you have available. And something else that I started to learn was that genetic testing, with a positive result, they are now finding that certain types of mutations do respond better to certain types of treatments. So there are a lot of benefits to the testing. And so I went ahead and did that. And, come to find out, I also was a carrier of this genetic mutation, and it put me at risk about 70% for breast cancer in my lifetime, as well as an increased risk for pancreatic cancer and a few others possibly. So when I got my diagnosis, I looked at my doctor and said, okay, so now what? What can I do? What can I eat? What should I do to decrease my risk? And the only answers that I got from 3 different providers were maintain a normal BMI, no alcohol, tobacco, and we're going to do screenings every 6 months. So essentially at that point, I felt like I was just waiting and watching, and that wasn't good enough for me. It wasn't good enough. I also have 3 daughters, so that was something that was in the back of my mind also, like, how can I help them in the future? And so I started to research, and I took courses in functional nutrition and integrative oncology and some genetics courses through, I applied through Harvard, their med school there. And so I started to really gain this understanding about cancer and how we can really have a big impact on our diagnosis and outcomes, regardless of what our genes say, right? So that's kind of where I started. And then once I started understanding how much of an impact I can have, I thought there are probably lots of people out there who are looking for the same knowledge. And so I started sharing it.
That's really inspiring. I mean, the career trajectory it took on, it's quite fascinating. So on to the next one. What is proactive cancer prevention? Can you please elaborate on that?
Sure. So to me, proactive cancer prevention means really understanding all sides of the equation and everything that might impact your risk of development and progression of the disease. So what I've learned is that cancer is really this perfect storm of genetics and environment. And there are so many players involved in the development and progression, and cancer needs a certain environment to grow and thrive, right? So proactive prevention is really learning how to recognize any imbalances and deficiencies in your body, whether it be through signs and symptoms, lab work, or other means, and recognizing what is going to make that environment in your body more or less permissive to cancer growth. And so understanding kind of what those big levers are can help you build a toolbox specific to the individual and help decrease risk.
Okay. So, Krista, is proactive cancer prevention effective for someone who has a genetic predisposition to certain types of cancer?
Absolutely. Yeah. So research has shown us that only 5 to 10% of cancers are linked to genetics. So approximately 35 to 40% are linked to other factors such as nutrition and environmental lifestyle factors. And I can't tell you how many times I've heard people say, it doesn't matter what I do, it doesn't matter what I eat, it's genetic. I'm going to get it no matter what I do. And that's really just not true. The field of epigenetics and nutrigenomics, their focus is really on how the things that we put into our body and the things that we're exposed to in our environments, how they impact the expression of our genes. And so just because you have genes and these mutations doesn't mean that you're always going to express them. So I think that's something that's really important to share. And even certain nutrients we're finding in the research and supplements and other factors can really impact the expression of tumor suppressor genes and oncogenes, or those cancer genes. So you can turn on the good genes and turn off the bad genes by the things that you're putting into your body and surrounding yourself with. So
okay. So, like, on the basis of environment, like, are there nutrients or specific foods that have been recognized for their cancer fighting abilities? Because this is very prevalent to everyone who's watching, right? Because the food we ingest has like direct ramifications with kind of health we build.
Yes, there's so many. The patients that I work with, we focus a lot on whole foods diet, and getting a lot of like fruits, vegetables, and other plant foods. Doesn't mean eliminating meat completely for everyone, in my opinion, but that is a big player. But also understanding cancer and its behaviors, we have found that there are certain foods that can alter its processes. So, for example, there was a paper written on 10 hallmarks of cancer by two people, Hanahan and Weinberg were their names, and they established certain behaviors of cancer. So I'll just talk about one of them and some foods that impact it. So one of those 10 behaviors that makes cancer so hard to fight is its ability to grow its own blood supply, which is called angiogenesis. And so there are certain foods that we've established can actually work against that process. So for example, walnuts, broccoli, cauliflower, almonds, and mangoes are foods that I include in my diet every day. And that's because the research has shown that they do impact the angiogenesis and can inhibit those processes. And so, it makes a big difference for cancer growth, and we can limit that, if that makes sense.
Yeah. So I'll segue to the next question. Why are trans fats detrimental to our bodies? Are there certain fats that we must consume, which are you would suggest at all times?
So trans fats are also, we know more, it's for me more common to hear partially hydrogenated oil. So it's one that is very detrimental to our health. It is oil that is altered chemically to increase the shelf life of different foods. So usually in processed foods, and the ones that last a long time in your cabinet, right? So they've been linked to several major health problems, including cancer, because they increase inflammation in the body and interfere with your body's ability to use the essential fats that we need for our normal processing. So those are the bad ones, the villains, I call them, the villains of the fats. And then the other fats that we know as good fats are monosaturated and polyunsaturated. So things like olive oil, nuts, avocados, walnuts, chia seeds, hemp seeds, fatty fish like salmon. Those are going to be high in omega-3s and omega-6. And at least here in the United States, omega-3s are something that most of us are deficient in. And they're what I call the heroes of the fats, because they play a major role in decreasing the inflammation in your body, and have also been studied in its effects for cancer. It can decrease the growth and size and proliferation of cancer cells. So really important.
Okay. And how important are water filters though? How do they help with our health?
So like everything, water is one of those things that we're putting into our body, right? So it's a big part of detoxification, but we want to make sure that we're not adding more toxins through our water. And believe it or not, even with all of the modern day advances, there are still a lot of things that are in our water, and it's going to be specific to where you live. And I've done a video even on my Instagram about how to find your city's water report and identify what toxins are in your water specifically. And then water filters, how to find a water filter that can eliminate those things from your water. So, but like everything else, it's important to know what you're putting into your body.
What are some of the biggest causes of inflammation? Is there preventive measures one can take to seep it out?
Yeah. Inflammation, it's good to a certain extent, right? It plays an important role in our body's natural defense system. So it's going to occur in response to tissue injury, infection, or any other irritants that we're coming in contact with in our environment. So to a certain extent, it's good and it's helpful. It starts to become a problem when it's more long-term or chronic. And so some of the big causes of cancer are, number one, inflammatory foods, right? So sugars, processed foods, refined grains, some dairy. Everyone is going to have different triggers, and it's very personalized, but those are some of the big ones that affect most people. So those things can be recognized as your body as invaders, and your immune system will launch an attack, and that's kind of where the inflammation is triggered. Another thing that is a big part of inflammation is stress and trauma in your life. So this could be physical, emotional, sleep related, or really anything that's disrupting or causing undue stress in your body. Even things like surgery, which are more physiological stressor, or emotional trauma from past life experiences, all of these things play a role, right? Everything's connected. So that's another big cause, is the stress and trauma. And then obviously toxic exposures, things like allergens or any environmental toxins, drugs, alcohol, tobacco kind of fall in that category. Any of those toxins are going to increase inflammation as well. But I like to also focus on the good things, right? So if we're not getting enough of the good in our diets, like antioxidants, vitamins, those good fats we talked about, the anti-inflammatory foods to support that healthy immune function is going to also have an effect on inflammation. So it's important to make sure we're getting enough of the good too.
Like, do the leafy greens also come in that?
Oh yes, of course. Yeah, those are big ones. So important.
Okay. And Krista, what advice would you give someone who is considering preventative mastectomy?
So that's one of those things that's so personal and has so many emotional things that play into it. So for me, one of the best pieces of advice that anyone ever gave me when considering a preventative mastectomy was to think about where you might be in 5 years and where you might be in 10 years and what's going to be happening in your life at that point and how you would feel about your decision if you decided to go with the surgery. And then how you would feel if you decided not to go with the surgery. And, the same thing applies to if you were to get a cancer diagnosis and you chose to do the surgery or chose not to do the surgery, how at that point would that affect your feelings about your decision? Especially if you have like children or family and how you would explain that to them. So really, if you're a journaling person, that's a good thing to journal or just consider. That was one of the biggest things for me that helped kind of guide my decision.
And I know this might sound a bit generic, but how important are sleep and hydration for cancer prevention and recovery? Because sleep is something every one of us is cutting down on day by day in this fast world.
Yes, that's true, especially in like the healthcare environment where I work, right? We have night shifters. So like everything, we've talked about, everything's connected and sleep especially is one of those things that plays a big role because there are so many direct links between melatonin and cancer development. And melatonin is important for preventing cancer. So your body makes melatonin at night in the dark. It's triggered by darkness. So the importance of sleep is, much more than fatigue, and one of those things. It's very important in that melatonin production, and that's why you see like night shifters have a higher risk of cancer because they're not giving their bodies enough time to produce the melatonin that it needs. Yeah, and hydration, kind of same thing. It's so important in like detoxification and normal cell function and optimal immunity, and getting rid of all of that, the bad and the toxins from your body. So both of them are so important.
Are genetic expressions influenced by the environment?
Yes, absolutely. Absolutely. Kind of like we discussed before, cancer needs a certain environment to grow. So things like inflammation, sleep, nutrition, stress, all those things are playing into it. And I like to explain it like a garden. So if you've ever gardened, you know that your soil in your garden has to be healthy in order for your garden to grow and flourish. And if the soil is unhealthy, it's really inviting to diseases and your garden doesn't do so well, right? So regardless of your, your genes, again, that environment plays a huge role in cancer.
Okay, and we are on to the last few questions, Krista. So cap it off with, what is your one biggest message to the cancer community, to our cancer community?
Yeah. So I think my biggest message would be to do the genetic testing. I think we live in a time when there are a lot of advances being made and we have so many tools at our fingertips. If you've already been diagnosed, test results can help determine the best treatment for you. If you've not been diagnosed, but you have a family history, especially if there's a pattern of certain types of cancer in your family, results could potentially save your life. And, my mom lost her life to cancer, but I feel like ultimately she saved mine and possibly the lives of my 3 daughters and generations to come. And so for that, I'll forever be grateful. And then share your results with family members who you could help. So your DNA is not your destiny, and we can really use it as a tool for prevention.
Thanks a lot. This was wonderful. and you provided us with truly valuable information. I just want you to let people know that how can they reach out to you, like your social handles and everything. Like how can they come in contact with you so that they can get more of your insights and your expertise?
Sure, thanks. So I am mostly on Instagram. I work at a clinic, so I limit it really to Instagram for this sort of thing. But it's cancer.prevention.coach is my handle on Instagram. So I'd love to have you. Anyone who wants to come. So, yeah.
And thanks a lot, Krista. This was wonderful.
Thank you.
Thanks for your time.
Okay.
Again.
Have a great day.
Thank you.